Hello guys, welcome back to my channel. My name is Pharmacist Oluwafunto Borokini. In this video, I'm going to be talking about the various methods of contraception available for women who do not want to get pregnant. If you're new to this channel, welcome to my channel. I hope you do like this video and I hope you do subscribe to my channel. If you're a returning subscriber, thank you for coming again. I hope that you do like this video and make sure that you give this video a thumbs up. Thank you. Now let's get to it. First, I'll be defining a few terms. The first is contraception. What is contraception? Contraception defines the various methods of preventing a pregnancy. What happens is that every 28 days, the female reproductive system produces some hormones through the anterior pituitary gland, that is the follicle stimulating hormone and the luteinizing hormone. This hormone stimulates the follicles of the ovary to produce an egg or an ovum, which is later going to mature and get fertilized by a sperm. All this happens to cause a pregnancy. When this fertilization takes place, it goes through the fallopian tube and implants itself to the uterus. So any process that is working against these processes from occurring is called contraception. Two, I'm going to define ovulation. Ovulation is the release of an egg from an ovary. I've already explained what happens, the hormones that are released to cause the release of this egg. Third, I'm going to be defining menstruation. Menstruation is simply the shedding of the thickened uterine lining. Like I was explaining the process of pregnancy, when pregnancy occurs, the uterus already prepares itself to receive this pregnancy. So when an egg is produced, the uterus lining begins to thicken so that when the baby comes in, it is thick enough to carry the child or to carry the fetus. In a case where pregnancy does not occur, the thickened lining of this uterus is shed. It comes out as tissue and blood. And that is what we see every month as menstruation. Finally, I'm going to be defining the term hormone. Now, what are hormones? Hormones are chemical messengers that are secreted directly into the blood, which carries them into the various organs and tissues in the body to carry out their function. Now that I've defined these terms, I'm defining these terms because they are crucial to your understanding of what happens in the process of contraception. Contraception takes place by three major mechanisms. The first one is that it prevents the release of an egg, that is, it prevents ovulation. The second one is that it tries to keep the sperm and the egg apart. That is, it thickens the cervical mucus so that the sperm is unable to swim through easily to reach the egg. And the third is that it prevents the combination of egg and sperm from implanting itself into the lining of the womb. So even if the egg is released, it can still prevent the sperm from reaching the egg. And even when the sperm reaches the egg, it can still prevent this combination from attaching itself to the uterine lining. I hope this is clear. Now I'll be talking about 5 hormonal methods of contraception. One is the pill, second is the intrauterine system, third is the contraceptive implant, fourth is the emergency oral contraception, and fifth is the contraceptive injection. I'm sorry there's some noise going on in the background. They are doing some welding in the area. Please just bear with me. First, I'll be talking about the pills. We have the combined pills, which contains the estrogen and the progesterone hormones, and we have the progesterone-only pills. These two are used the same way. The progesterone-only pills is also known as mini pill. They are to be used same time every day, that is 24 hourly, whether you have sex or not. What they do is that they prevent ovulation from taking place and they thicken the cervical mucus, so the sperm will find it very difficult to reach the ovum. Why should you choose pills? First of all, they are easy to use. You just have to use them. They are very small. You just have to use them same time every day. You have to set an alarm on your phone. Use it same time every day. They are highly effective. As long as you are using it rightly, you're maintaining the time and you're not missing the dose, then you're going to get like maximum results. They are highly effective. unless you don't use it rightly. They allow sexual spontaneity. You are free to have sex anytime as long as you're on the pill. And they can be used over a long period of time and still be reversible. What you might struggle with while using the pill is the problem of adherence. A lot of people have issue with using drugs every day. They tend to forget, or they tend to miss the time, and the moment you begin to miss the time or you begin to forget, the drug may not be as effective as it's meant to be. Another thing you may struggle with is side effects. Anything hormonal always comes with side effects. Some will come with breast tenderness, or some cramps, or acne, and so on and so forth. Some women get high blood pressure, but that is rare, so you just have to be observant to be sure that the pills are working fine for you. Next, I'll be talking about the intrauterine system. There's a difference between the intrauterine system and the intrauterine device. The intrauterine system is the hormonal one, so that is the one I'm going to be talking about in this video. The intrauterine system is what they use is like a small T-shaped device which contains progesterone hormone in small doses. So there is a reservoir containing the hormone progestin in this T-shaped device, which is placed inside the womb, and is going to be releasing this hormone in small quantities over a long period of time, hereby preventing pregnancy. What it does is that it thickens the cervical mucus and it thins the lining of the uterus. Just like I said earlier, for pregnancy to take place, the uterine lining should be thick. So this method will cause the uterine lining to be thin, and it will cause the cervical mucus to be thick, so the sperm will find it difficult to go through. Why should you choose this method of contraception? One is that it can last for about 3 years, sometimes 5 years, but it can last for up to 3 years. Two is that it is highly effective, about 99.8% effective. It is highly effective and it can last for up to 3 years. I think that is a very big advantage of this system. Also, every period can become shorter, lighter, and less painful. This is a big advantage for a lot of women who experience heavy, painful periods as well. So this is also an added advantage. What you may struggle with is the fact that it requires professional help to insert it and to remove it. It's not something that you can just take by yourself like the pills. It's something that requires professional help to insert and to remove. Also, you might struggle with side effects. Like I said earlier, it can cause weight gain, breast tenderness, pain, cramps, side effects that come with hormonal treatments in general. The third method of hormonal contraception is contraceptive implants. These are silicone rods containing the progestin hormone put under the arm or under the skin by a healthcare professional. It is shaped like a matchstick, and it's supposed to release the progestin hormone slowly over a long period of time. It lasts for up to 3 to 5 years. It can stay for up to 3 to 5 years, and it is highly effective at about 99.95%. So it is very rare for it to fail, like it doesn't fail. What the contraceptive implant does is that it prevents ovulation and it thickens the cervical mucus so that the sperm cannot reach the egg. It may also cause side effects associated with hormonal drugs, like I said earlier. Now, the contraceptive injection. This is getting a shot of hormone that lasts for up to 1 to 3 months, usually for 3 months. An example is the Depo Provera injection, which contains medroxyprogesterone acetate, which is usually given every 3 months. It contains the hormone progestin. It typically suppresses ovulation, that is preventing the ovaries from producing an egg. And this method of contraception is 94% effective. So it is quite effective. 94% is a lot as well. Most common side effect is irregular bleeding within the first 6 to 12 months of starting the injection. A very big advantage of this method is that it can be used while breastfeeding, and I didn't mention that contraceptive implants can also be used while breastfeeding. About 6 weeks into breastfeeding, you can use the implants. This method is also safe during breastfeeding. It may also reduce heavy or painful periods. Side effect of the hormonal injection is that it may be difficult to track the months. Like, you have to keep the months that you have taken in mind so you don't mix up the months. Then it can cause other side effects like weight gain, breast tenderness, like the ones I mentioned before, and it is known to cause bone density when it is used for more than 2 years in a row. So it's not something that you can just keep using for over a very long period of time. Finally, the last method of hormonal contraception I'm going to be talking about is the emergency contraception, also known as the morning after pill. The morning after pills, that is the levonorgestrel tablets, are known to temporarily prevent ovulation. They actually work by two mechanisms: temporary prevention of ovulation, and also by thickening the cervical mucus so that the ovary, so that the sperm cannot reach the eggs. If ovulation has already taken place, that is, if it cannot temporarily stop ovulation, it can thicken the cervical mucus so that the sperm cannot easily reach the egg. This method of contraception requires timing. It has to be used within 72 hours of unprotected sex. It is most effective within 12 hours of unprotected sex, and it must be used within 72 hours. After 72 hours, it cannot be guaranteed to be effective. So you can classify it the most unsafe method of hormonal contraception, because once you go beyond the time, it may not be effective. The side effects of this method of contraception is changes to the period. The period may come later, it may come earlier, it may be more painful, or it may be more heavy than usual. So it may also come with other hormonal side effects like acne and all of that I mentioned previously in the other hormonal methods. So I've talked about 5 hormonal methods of contraception. I talked about the pills, the intrauterine system, the IUS, that's the IUS. I talked about the contraceptive implants. I talked about the contraceptive injections and the emergency oral contraception. So these are 5 hormonal methods that can be used to prevent pregnancy. I've talked about the pros and the cons. It's left to you to decide which of these methods you want to go for. In another video, I'm going to be talking about the non-hormonal methods of contraception. We have come to the end of this video. If you watched up to this point, that means you definitely liked the video. Don't just like it in your mind. Click on the thumbs up, like this video so it can reach more people. If you're yet subscribed to my channel, please do click on the subscribe button so you can be a part of this family. Subscribe to my channel and put on the notification bell so you can be notified whenever I put on a new video. And I'll see you guys in my next video. Thank you. Bye guys. Bye.